Good afternoon, everybody. Thanks for joining. We're going to give everybody another minute or two to get logged on, and then we will get started. Hi, everybody. Good afternoon. We are at the top of the hour, so we will get started now. So, thank you so much for joining us today. Over the next hour, we will explore how hospitals can strengthen staff safety in the face of rising workplace violence, burnout, and mental fatigue, and how a more holistic approach, supported by RTLS-enabled technology, can help create safer environments for caregivers while improving patient outcomes. My name is Katie Nolte. I'm the Marketing Communications Manager at CenTrak, and I'll be serving as your moderator today. Before we get started, just a few housekeeping items. Today's session will last about 60 minutes and we'll have a live Q&A at the end. You're currently in listen only mode. If you have any questions at any point, please submit them using the Q&A box and we'll address them at the end. And this webinar is being recorded, and the webinar and the slide deck will be shared with you within 24 hours. We're joined today by two experts at the intersection of clinical operations and healthcare technology. Mary Jagam, MS, RN, CEN, FAEN, is a nationally recognized leader whose career spans frontline nursing and healthcare innovation. A former national president of the Emergency Nurses Association, she has spent more than a decade helping health systems implement real-time safety and asset tracking technologies. We're also joined by Ashlyn Cunningham, Global Product Manager at CenTrak. A biomedical engineer, Ash leads product strategy and development focused on improving the safety, efficiency, and experience of frontline healthcare providers and their patients. Together, they bring both clinical and technical perspectives on how hospitals can strengthen staff safety through real-time visibility and rapid response solutions. Healthcare organizations are under increasing pressure to better support caregiver safety and well-being while maintaining high standards of patient care. Many traditional protection methods often lack visibility and rely on reactive response models that no longer meet the needs of today's care environments. In this session, we'll explore how more comprehensive organization-wide approaches supported by modern safety technologies can help foster a culture of safety. CenTrak has partnered with health systems around the world to implement safety, visibility, and workflow solutions that drive measurable improvements in response time, staff confidence, and overall safety outcomes. While RTLS supports a wide range of clinical operational workflows, today's focus will be on staff duress and safety solutions. The same BLE multimode staff badge that's used for duress can also support nurse call automation, hand hygiene, and workflow optimization, enabling hospitals to leverage a single platform across departments while reducing costs and simplifying adoption. And with that, Mary, I'll turn it over to you to get us started.
Great. Thank you, Katie. You know, it really comes down to this. Staff need to feel safe in order to provide good patient care, right? If they don't feel safe for themselves, it really impacts their ability to focus on their patients. The statistics keep going up regarding the issue of workplace violence. We know that at least healthcare workers are at 6 times greater risk of being a victim of workplace violence than any other private sector workers. And again, that number keeps increasing. But we also know that most of the data that we have today is underreported because the issue is probably far worse. We know that staff often don't report incidents that occur. So you have to keep that in mind as well, that the problem is greater than the data shows. Emergency nurses typically experience workplace violence, either verbal or physical, on almost a daily basis. We know that over 50% of healthcare workers feel that their organization that they work for is not taking workplace violence seriously and focusing on their safety. 73% of workplace violence-related injuries also meant that staff lost work. Maybe it was because they were injured in the event, or maybe they are just emotionally traumatized by the attack itself and unable to effectively work in their job for a period of time. 20% of all healthcare workers today feel unsafe at work. Do you know of any other profession that has that same feeling amongst their workers right now? You know, it's really a really critical fact to understand that 1 in 5 don't feel safe in their job. Press-Ganey did some additional study on workplace violence, and they found that that staff are experiencing assaults at a rate of 2 per hour, 57 a day, and it comes out to about 20,000 a year. And we know, again, these numbers have been on the rise. They were increasing they started increasing in the 1990s, actually. And then we saw a steady increase in that. And then we saw a significant increase with COVID. We also understand that the incidents of violence are really rising in emergency departments, behavioral health, and pediatric institutions. Of those events that occur, about 2% of them result in a staff member, typically a nurse, being injured. And when they are injured, those cost near about $100,000 in terms of medical care, legal care, loss of work time, things like that tie into that number. And if we do lose that nurse in the workplace because they just don't feel safe enough to work, especially those nurses that work in specialty areas like emergency nursing, critical care, the cost to replace them is very high, typically about $60,000 to $100,000 per nurse. So they're really a valuable resource that you want to, be able to keep working within the organization. Organizations as a whole are spending more and more money on an annual basis related to workplace violence. Currently, next slide, Katie. Currently, organizations are spending about $18 billion a year, with about $3 billion of that being spent on prevention, such as the technology we're talking about today, and training and things like that. And the majority of them, that cost is being spent on post-event. So things like treatment for the staff member that was injured, again, loss of work time, maybe temporary staffing to cover their shifts. There might have been infrastructure damage within the facility related to the incident. So the post-event is way more expensive than the preventative costs. So it's really a good investment to invest in preventing the situation from occurring in the first place. Next. And we also are finding more and more that during the interview process, nurses are looking and asking questions regarding how that organization is going to help them keep safe. What things are they doing to assure their safety while they're on the job? And this really hasn't been the case before, but we're really starting to see that now. Next. Workplace violence overall has an impact on patient care and safety in many different ways. First of all, you've got staff that are short-staffed. They're maybe getting exhausted from having to pick up extra shifts, right? And when they're tired at work, the additional stress related to violence in the workplace, it just causes them to make mistakes. right? Because their mind's on other things. And so they can cause mistakes and medication errors or things like that that could cause harm to patients just because of their environment that they're having to work in. We know that staff, when they are able to focus on what they're doing, they're going to provide better care. If a staff member is concerned about being injured by other patients in the environment or the patient they're currently caring for, they're not going to want to engage as much at the bedside because it just doesn't feel like a comfortable and safe space for them. We also know that when staff are feeling unsafe, they're more likely to leave that particular employer and go seek a job at an organization that does focus on safety more. And we know overall that those organizations that help staff to feel safe and supported in their environment have much less incidents of violence, and their staff, really feel like that organization cares and that they're well supported. Next, Ash is going to go over some of the technologies that can help staff to feel safer in the workplace.
Thank you, Mary. So, Mary in the previous slides talked about why staff safety is such a critical priority for hospitals and the impact that workplace violence has. I'm going to now talk about some solutions that you can put in place to improve staff safety and therefore improve patient care. And the solution that we're going to talk today about is an RTLS solution. For those of you who are unfamiliar with RTLS, RTLS stands for Real Time Location Systems. And if I was to really boil it down, an RTLS solution can basically provide the location of anything, anywhere. And in the case of a staff duress use case, that means providing the location of a staff member who is needing help in a duress event. An RTLS solution that serves the staff duress use case has many components to it. First, you need the infrastructure or the technology backbone that's going to be able to provide that location information and then communicate it back. You need a device that a staff member can interact with to press or call for help. You need an alerting system and a reporting system. And over the next few slides, I'm going to touch on the importance of each of these parts of the solution so that you know what you should look for when evaluating a staff duress solution for your facility. First, we're going to take a look at the infrastructure on this slide, which really is the backbone of the whole solution. The choices that you make here in technology for your infrastructure is very, very important because ultimately the choice that you make in this infrastructure will decide what level of accuracy of your location information you're going to have. So there are 3 layers here on the screen, with the lowest level of accuracy on the bottom, the approximate level of locating, and the greatest level of accuracy on the top, clinical grade locating. At the bottom, leveraging BLE alone, so BLE is Bluetooth Low Energy, we can give the approximate location of a person. We can basically tell you an area or a zone that that person is in a duress event. We've heard from a lot of our customers and their security teams that if we can point you to the direction of the particular ward or unit that an event is happening in, that's enough information for them to go by to be able to help that person. So approximate level of locating is enough for some folks, and they are happy to just use Bluetooth Low Energy to give that approximate level of location to help find a person in a duress event. For as many customers who tell us that the approximate level of location or the zonal level of location accuracy is enough, we have customers who say, no, actually, I want to know the exact room that that person is in a duress event. And so on the other hand, at the top of the screen, we have something that CenTrak calls clinical grade locating or room level accuracy. And this leverages technology such as infrared, so light, which requires infrastructure devices to be placed up into the ceiling to give you that really crisp room level accuracy. So you know that that person is in room 108 in that duress event and your security team can go and find them. And then in the middle, we have something that we call selective certainty. So we have customers who actually want to leverage a blend of technologies to give them a mix mash of levels of locating throughout their facility. So they may have BLE approximate locating in certain areas, and then they might leverage infrared in certain areas to get them that crisp room level accuracy, maybe in problem areas like the emergency department or behavioral health units, for example. It's really an important decision for a facility to make what level of accuracy that they would like from their staff duress solution and what works for both their clinical teams but also their security teams. And choosing the right technology should help you fit the needs and wants of your unique facility, and RTLS solutions can be flexible in that way. So that's the infrastructure piece. The next part of the solution is the device or wearable that the staff member interacts with to call for help. Um, this is a part of the solution that must be easily accessible, easy to use for a staff member who's in a duress event. And the most common version is a wearable staff badge. And on the screen is CenTrak's version of this, and we call this the BLE multimode badge. The main function is the ability to be able to call for help. And this is often achieved by staff badges through the press of a button. And you can see on the screen that we actually have 3 buttons on our badge. All 3 can be used to call for help, but we have certain customers using the buttons for different purposes too. A couple of key things to look out for when you're evaluating staff badges and what's good and what's not so good. Um, Buttons should be designed in a way to reduce accidental button presses. We do not want to have false button presses that create duress notifications that send security teams into a panic, and therefore create alarm fatigue. So good kind of design practice here is having buttons that are recessed from the front of the badge. So it makes it more difficult to accidentally press that button. Ours are actually placed on the back of the badge, so staff members can actually discreetly and subtly call for help. So they're not drawing attention to that button press, and drawing the attention of the aggressor. Some other really cool features of staff badges, which are great, are the introduction of a card holder into this badge. So you can see on the front of the badge, we have these little lips that can hold the ID card of a nurse or a staff member. Um, I've seen nurses with 30 plus things hanging off of a single lanyard that looks fit to breaking. So we've incorporated this into the badge to be able to reduce the number of things that folks are carrying by one. Good staff badges should also be designed with the healthcare environment specifically in mind. Badges should be incredibly durable, both physically and chemically. They need to be able to withstand drops from a height. They must be able to withstand some of the common cleaning materials and chemicals that you find in hospitals, sani wipes, bleach wipes. Ultimately, in my opinion, the badge is the most important part of your staff duress solution, because this is the part of the solution that your staff members, your nurses, your staff are interacting with the most. So ensuring that the badge is right for your staff, that it has the features and functionalities that your staff members like and are useful to them, and that you have buy-in is incredibly important. Next slide, please, Katie. Thank you. Another thing to mention here is that within the RTLS healthcare world, the staff badge can actually be used for a multitude of different use cases, and Katie touched upon this earlier. Um, the same staff badge can be used for other kind of value-added scenarios that can widen the impact and maximize the value of the badge. And we have a few of the use cases and scenarios listed on this screen. Automated nurse call cancellation, so the ability to cancel the lights flashing above a patient room when a nurse enters the room automatically. We have infotainment integration, so when a nurse walks into a room, their name, role, photo, maybe a fun fact about them is popping up on the screen, and that is great for patient experience. Clinical workflow, electronic hand hygiene compliance monitoring, contact tracing in events where you have infection exposure. Um, This just demonstrates the impact that an RTLS solution with a staff badge can have, not just only on staff duress and safety solutions. So we have the infrastructure, we have the badge that allows for the call for help. The next part of the solution that is awfully important is the alerting piece. And there are multiple ways that you can get across the message that a duress event is happening. And a good staff duress solution should be able to provide that flexibility, that wide range of ways to put that message out across to the rest of the staff members in the facility. You can have alarms that show up on your computer workstations and display monitors that are in nursing stations or in your security hubs. You can have alerts sent directly to security dispatchers, voice of internet protocol messages that are sent via Wi-Fi, SMS messages that are sent via cellular, email alerts, configurable HL7 messages. The ability to call for help to the right people in the right manner is absolutely key and is unique facility to facility. There are multiple ways to do it, and it's very, very important within a staff duress solution. The next slide actually goes through CenTrak's version of our alerting system. So this is Duress RT, which you are seeing on the screen. It's our cloud-based staff duress software application. And as you can see, the first thing on the screen is a map of the facility. In the event of a duress scenario, the map will automatically hone in on the area that a staff duress event has been alerted in. It will convey the necessary and important information, such as the name of the staff member, the location, timestamps of when the button was pressed, and it will also continually update the location of the staff member if they so happen to be moving. The software application, ultimately, it should allow for the rapid location and then response to staff duress events. And additionally, CenTrak also has a mobile application of this software. It's designed for security personnel in mind, so that when they are en route to an event, they're able to receive real-time location updates of what's happening through their mobile phone, not behind a desktop. They are able to respond, accept alerts, escalate alerts in real time on the move. It's a very useful piece of the solution, specifically targeted for the security personnel, whether that's police or public safety officers. Another really important feature of any software application that's part of a staff duress solution is the reporting aspect. And this is really important for security and clinical teams. Reports should capture alert analytics with timestamps, location updates, the names of the staff member who are involved, duration of alerts, messages, everything that was done in the time duration of that event. That should be captured and reported by the software application. Mary will go into much greater detail about the need for this and the why, but ultimately having this detailed information and logs help teams perform retrospectives to understand what happened and therefore what they can do better next time. And ultimately, the software application is the part of the solution that ties the whole thing together. It allows your security personnel to respond to that call for help swiftly, act swiftly to ensure staff safety, but then also allows them to retroactively learn and improve their workflows for the next potential event. So those are the key parts of a staff duress solution. You've got the infrastructure, the technology backbone that provides the location of that person and then communicates that back. You have the badge that a staff member wears that allows them to call for help. And then the software, which generates the alert, sends that alert out to other folks, and ultimately does the reporting that helps you analyze what actually happened. All components are 100% necessary in order to have a system that delivers a reliable staff safety solution that helps protect all your staff members in the workplace. I'm going to hand it now back over to Mary to talk through what are some of the best practices that you can use for when you have implemented your chosen staff duress solution.
Thanks, Ash. I've been implementing staff duress solutions for approximately 14 years. And I've learned a lot of really important lessons over those 14 years. And this next set of slides is going to go over some of those important things that learn to really make your solution successful in your organization. The first is that we always recommend that you put together an enterprise-wide steering group, and that your solution, the technology is fabulous that Ash just went over, and it's going to definitely help to get the staff members assistance when they're in a duress situation. But it's not going to be successful if you don't have the people in the process behind it. And that's what a steering committee can really help you do. And in the solution, the technology should be part of a bigger strategy around dealing with workplace violence and keeping staff safe. So it shouldn't be the only thing that you do, but it's a really important component of the overall solution. One of the first things the steering committee would want to do is to do a risk assessment for the organization. Every facility has different set of risks. Some of it is depending on the type of facility. Some of it has to do with where the facility is located. So there's many different factors that can tie into that. And understanding what your risks are is a really good self-discovery process for an organization if you've not previously done that. You also want to put into place, first assess, and then optimize documentation that you have around staff duress events. Because oftentimes organizations are not getting the complete picture. Maybe they've documented that an event occurred, but maybe they don't keep track of what were medical costs related to that, what was loss of work time related to that, were there legal costs, what kinds of things were all involved in that particular incident, so that you've got a complete set of data. And it's really important to build out a process so that you can make sure that you're capturing all of that information. And then this is data that you'll want that steering committee to be reviewing on an ongoing basis so that you understand, are we improving? Is it getting worse? Is there certain areas where things are escalating? This will really help you, again, to make important enterprise decisions for your organization to keep staff safe. You want to incorporate reporting incidents of violence as part of the daily safety huddle in the organization. It's really good to keep this top of mind so that everybody remembers that it's not only about patient safety, it's about staff safety as well in the organization. And then your steering committee will also want to consider all kinds of diverse strategies. There can be flags put in electronic health records that raise awareness about a patient that maybe was previously involved in an incident. There are options around weapons screening, both metal detectors and wand screeners. There might be other things that you want to implement, such as an organization I worked with had in the emergency department, they had magnets that they put on the doorway outside of a patient that said "to in" if it was a high-risk patient for violence, so that no staff member ever entered that room by themselves. So there's all kinds of things that you can think about that can help tie into that culture of safety within your organization. And then, of course, as part of your staff duress alert, we'll want to make sure that we're having the appropriate response teams and who's going to be responsible for following up with that staff member afterwards to make sure that they're okay. On your steering committee, we've got some groups that we would recommend that they be a part of that steering committee. Doesn't mean you have to limit it to these, but these are good to consider. And also, I would strongly recommend that you have an executive level presence as part of the steering group. You really need that top leadership champion as part of that group so that they can help to bring that voice of the organization and also bring the decisions that the group is making back to the rest of the leadership team. So they're really an important player. And then you'll want representation from nursing, security. Usually information technology is involved in the technology piece of things. Learning services helps to make sure that we've created appropriate training tools for the staff. Some organizations I've worked with have been very creative in terms of creating videos and other things that help staff to understand the badge that Ash just went over, how to utilize it, how to take care of it, and it could be part of a greater educational promotion around staff safety in the organization. Communications will help get the word out, make sure everybody knows what's going on in terms of the solution that's in place and how it can be implemented, where it's being implemented, things like that. And then your risk management folks, those folks can really help to complete some of that data gathering and look at the different sources of data related to workplace violence and help to bring it all together for the organization. Some steps that we've learned that are very helpful in making sure you've got a successful go live with your staff duress solution. One, engagement. We've got that steering committee. We want to have leadership buy-in. We want to have representation from the different clinical teams as well as security involved so that you've got lots of engagement at all levels of the organization. And if you're expecting staff members in your organization to wear a badge for safety, I would highly recommend that the leaders in the organization wear them as well. I think that really sends a very strong message to them that this is important and you want to exemplify and be a model for that importance. Again, your solution should be part of a system-wide culture of safety in your organization, not the whole solution, but definitely an important piece of it. There's different things that you want to look at in terms of readiness of your organization for implementing your staff duress solution. So some things you want to look at are, who's going to be responsible for different components of the solution. You've got your staff that'll be the alerters, the alert generators, right? Who's going to be receiving the alerts? Who's going to be responding to the alerts? Who's going to be, again, following up with the staff after the alerts? Who's going to be making sure the data is documented properly? And then who's going to be your badge managers? So you're going to have staff that are going to come and go in the organization. How do we make sure that everybody gets the badge that they need? Things like that. And then the training provided should be role-based. So depending upon all those different groups and the roles that they will play in the solution, making sure that each of those individuals is trained to perform that role. And then, we'll provide good support during your go live process so that you can, I always recommend rounding with the staff on the different units, make sure they understand how the solution works, how they can get help, some helpful tips about how to wear the badge properly and things like that. And then data review. It's really super critical in those early days once you've implemented your solution. And then, on an ongoing basis as well after that. So you see what kind of events are happening. Did everybody understand, what was supposed to happen? Was the response correct? How's the response times looking? Does it look like people, are understanding, again, how the solution works and how to document everything properly? Do we need to change anything in terms of how the solution is working? All that will bubble up through that data review and analysis. We have partnered at CenTrak with many different other technologies so that we can make sure that the alerts generated from our staff duress solution can get to the right place for the appropriate response. So whether that means we're integrating with Rollin to run those alerts through a nurse call system, or some of the mobile device companies We've integrated with camera video management systems so that we can help to turn on cameras in the area where an incident is occurring. We, of course, have integrations to Active Directory, other middlewares, all those different types of technologies that can really help us to make sure that the alert message is being delivered promptly and appropriately to the right recipients. As Ash mentioned, the data and reporting tools that we have within our solution really help you to understand what is going on in the organization related to the staff duress events. So it will help you to identify, where are our greatest events occurring, time of day of week. Are there trends that we can identify? Do we need to adjust security staffing based on the information that we're gaining through this solution? So it can really help you to identify what's going on in the organization. It's really a powerful information for your leadership to have to understand those events that are occurring, and so that it can appropriately provide ongoing resources to address those. Data analysis is integral to also understanding what's working well and what you might need to adjust in your solution. So I recommend, if possible, to compare the RTLS duress events that we're seeing. So staff's ability to call for help before an incident escalates, right? Look at that data and compare it to what's being reported through your event reporting system. They likely won't match, and that's okay, I think, because the whole point of the staff duress solution is that staff get help right before an event escalates. So oftentimes it's pre-event, which is just great. Pre-event can mean a no event, and so that's why it likely doesn't make it into your event reporting system. However, you should look at the events that are occurring that don't have a corresponding staff duress event in the RTLS solution, because that may indicate that we've got violent events occurring in a location where staff perhaps have not received badges yet. And that might be an area that you want to consider deploying to, in the not too distant future. So it's really important to look at both sources of information and see what's the same and what's different, and what is that telling you. You want to also look at, review the RTLS solution to look at how alerts are being communicated, the response time that we're seeing. Are we getting help quickly enough? I think that's also valuable. One of the things that we've looked at with the data over the years is we looked at the difference between an organization that's alerting just maybe directly to security, and those organizations that are not only alerting to security, but also sending out local alerts, so to staff within the department of the event where the event is occurring. And what we've found is that if you're able to also send it locally, such as to mobile devices, that can cut the response time of somebody being at that staff member's side in half. Because somebody's almost always close by, they just don't know that somebody needs help. So by being able to let them know that can really get that staff member some help until security arrives. Next. One of the most important metrics in looking at the success of your staff duress solution is measuring staff perception. But I've also found that it's one of the most overlooked metrics as well. So it's really important to see how are staff perceiving what you're doing, not only maybe the staff duress badge, but you can also include evaluation of other components of your workplace violence solution as well. But how are they perceiving it? Do they feel like the organization cares about their safety, or are you still missing the mark somehow and need to beef up this, how the solution is working, or other factors that aren't being addressed, so that staff can really feel that feel that sense of safety and the organization cares about them. So it's important information to look at and to trend over time, and also something to ask about on exit interviews. And we've actually been able to tie our staff duress solution to a decrease in turnover rates. Through doing that, we worked with an organization that was asking those types of questions, that had our solution in place over a period of years. And so they're able to to really tell, how effective it's been, and whether it's made a difference in staff leaving or not. Next. So these are really some great pearls of wisdom that we've gained over time that I wanted to share with you today. Number one, and I think this is so critically important, is over and over making sure that you message to the staff that their safety is important to you, that they are important and their safety is important. And that's why we're implementing solutions to help keep you safe. And you can't really say this too often, I don't think. I had the opportunity to round frequently in an organization over a period of time where we had badges deployed. And I always started my conversation like that. And I could see how it changed the staff's perspective around the solution, and how it improved their their feeling of the organization caring about their safety over time. Privacy first. We have options within the software to control how visible a staff location is throughout the organization. Different organizations will want different levels of visibility. Some don't want it visible at all, except during a duress event. Some want it their current location visible all the time. So we can really modify that depending on, what is the preference of the organization. I would always recommend that we block access to location history, except through a pre-approved process. If it's needed, sometimes it is very much needed for a risk event or for contact tracing or other types of needs that come up. So it is valuable information to have available, but you really want to control how it is available, I think. You want staff following an event to feel like, again, the organization cares about their safety, and make sure that there is a leader following up with them afterwards. It can be the charge nurse, the manager, director, executive in the organization, but somebody is following up with them to make sure that they're okay. Do they need medical attention? Do they need counseling? Do they need time off? What do they need? How can you support them through this incident that occurred? And I think that is really critical and often overlooked as well. So they really need to feel, really engulfed in that support from the organization, because it'll make a big difference if they don't feel that way. And again, making sure that you've got a data review process in place so that you can review all the different components of your solution and understand how effective they've been. Some really important things to just keep in mind as we close this session. Staff safety is patient safety, right? If staff feel safe when they're providing care, they're going to be able to be better focused on the care that they're providing to their patients. And I think that's really critical. Violence can increase that feeling of burnout. They can feel very stressed by incidents that are occurring on a daily basis in their organization, or if they've got every other patient swearing at them all day long. It takes a toll, right? It takes a toll, and those staff it's likely to lead to burnout and perhaps them leaving their jobs eventually. And for sure, it will increase, other types of errors and other things that happen in the organization. A real-time solution, such as the one we've overviewed today, can help get the right folks to that staff member's side promptly. It's going to tell them who and where they're at immediately when an incident occurs. And that can help really save a staff member's life. in many cases. Data and preparedness matter. It's really important that you have a full set of data related to each event that occurs, that you're reviewing the data on a regular basis to understand what it's telling you and how you can continuously improve the solution. And then knowing that the things that you're doing today to build a safe environment for your staff are going to have long-term outcomes for you in terms of reducing turnover, helping staff have a good feeling about the place that they work at. They're going to feel trusted and supported in their roles. And that's really going to make a difference, not only in how the staff member feels, but in the care that they're providing. Katie, I'll turn it back over to you.
Thanks, Mary. And Mary, Ash, thank you both for such an informative presentation. So now we're going to transition into the Q&A portion of the webinar. So if you have any questions, please type them into that Q&A toolbar that you see on your screen, and we'll answer them as they come in. But in the meantime, we do actually have a quick poll question for you. So this should go live on the screen shortly, but if you could please respond and let us know which staff groups are important for your organization to protect with a staff duress solution. We would really appreciate that insight. And so we'll jump into the Q&A here while you vote, as we do have a few questions already. So the first question we have, can a staff member cancel a call for help with the BLE multimode badge?
You can cancel a call for help using the badge. It's not actually best practice to implement that feature because you would hate to have an event where a staff member accidentally cancels their call for help and they are actually in a duress event. So we don't encourage or list it as best practices when we implement our staff duress solution, but the ability to do it is there should you wish.
Thank you, Ash. Another question we have in the chat, can this device be used in a way to signal other duress situations and request a specific response? For example, a post-fall, bring the lift or the sling.
Yes. So our badge in particular, as you will have seen on the screen, it has 3 buttons. I think I mentioned that you can configure those buttons to mean a multitude of different things. So we have certain customers that want all 3 of them to be a call for help button, a duress button, but you can configure other buttons to deliver other specific notifications. So maybe it's a staff assist rather than a staff duress, or maybe it can trigger workflows. So simple answer, yes, with the BLE Multimode badge, because it has that multi-button functionality, it can be used in a way to signal other things too.
Great, thank you. Another question, somebody would like to know about the care experience team, so employee patient experience and safety departments and how that representation looks. They didn't see that on the stakeholder list, so they were curious for more information on those.
Oh, absolutely. If you have those groups within your organization, absolutely, they should be involved. I kind of umbrellaed them, I guess, under risk management a little bit. But yes, they should definitely be involved in both the steering committee and in all aspects of deploying the solution.
Thanks, Mary. Another question we have, I know we covered it. I think this was after this question was named, but a good point to bring back up. Are there any named systems that you integrate with, for example, any nurse call vendors?
Yes, absolutely. So on the nurse call side, I think Mary's slide had a few of the kind of key names popped up, but we have integrations with Roland, Ascom, Baxter, Westcall, Geron, a smattering of others too. But we have a lot of integrations with various different nurse call vendors.
Thanks, Ash. Is there any data to suggest the RTLS duress events being integrated to nurse call for immediate local annunciation, improve response times, or outcomes?
I don't know that we've studied that incident specifically or that situation specifically, but it certainly is one way, and we often see that in inpatient areas in particular, where they will route it through the nurse call system and then have an established escalation process in place where they can escalate promptly to security, should it be a security event. Other organizations will separate things out a little bit and maybe use one of the other buttons on the badge and do a staff assist through the nurse call system and then run the staff duress directly to security. So it can be shaped in different ways depending on the organization's needs.
Great, thank you. What kind of infrastructure is required prior to implementing this system?
Yeah, great question. So it all is dependent on what level of location accuracy that you're wanting. So if you recall back to the slide with kind of those 3 layers, if you are wanting just the approximate level locating, we're going to leverage something called Bluetooth Low Energy or BLE. This is probably the most the way of deploying that requires the least amount of infrastructure. We can even leverage existing infrastructure that you might have in your facility already. So if you already have BLE-enabled access points from Cisco, Aruba, Juniper, we can actually just leverage that to give you a location, and you don't need anything more to be able to give you that coverage. If you do want that clinical grade level of locating, that super crisp, accurate, room level accuracy, that is going to require CenTrak's kind of proprietary Gen 2 IR devices. So these are devices that will need to be placed on the ceiling. It leverages IR, so basically curtains of light that basically can distinguish between areas in the building, give you that really crisp room level accuracy. So the answer is it depends. It depends on what needs you have, what level of it leads from there.
Thank you, Ash. Another question here. Somebody wants to know, does the badge stay with the employee, and how does the RTLS turn off when they leave campus for the day?
It would be our recommendation that each badge is assigned individually to staff. So when folks are responding to an incident, you know exactly who you're looking for. So I think that would be our best practice. Sometimes, you know, there's a need for some generic badges, so to speak, available for floats or other individuals who might have just short visits to a department over a period of time. And then when depending on how we've got the solution set up, most cases, the badge does not work outside of the network that we've established for it, unless you're utilizing the mobile duress solution that we've got with the mobile app, in which case that solution can carry over, such as into parking areas, parking decks, or for your home health staff.
Wonderful. Thank you. Somebody is asking about hand hygiene compliance. So they're curious on the methodology of capturing that compliance with the badge.
Yeah, I can take that one. So for hand hygiene compliance, we have some additional infrastructure that's needed that gets added to your soap dispensers or your sanitizer dispensers. And ultimately, the way that we measure compliance is if a staff member with their badge is located in the room next to the dispenser, and the dispenser has dispensed the soap or the sanitizer. You marry up those 2 pieces of information, and that is what we call a compliant event. So the right staff member has entered the room within a certain amount of time period. They have washed their hands. And then once the staff member has exited the room, have they also washed their hands too? So it requires just a wee bit more additional infrastructure on the sanitizer part of it, but the staff badge actually provides that location and timing information of, you know, did they walk into the room, a patient room, and when they walked out. And then the sanitizer infrastructure gives you that information of whether that dispenser was dispensed.
Thanks, Ash. And while I have you, I do see a couple questions in here about specific integrations. So if you wanted to maybe speak a little bit to the variety of integrations that CenTrak offers, that would be great.
Yes, absolutely. So CenTrak has integrated with over, I would say, 100 plus different systems. CenTrak has been in the healthcare RTLS space for over 20 years. So we have built some really deep connections and partnerships with different vendors across the healthcare space. We do have a very open platform philosophy, with kind of a very broad and open approach to integrations. Happy to chat with folks individually on very specific integrations, but generally we have plenty. And if there is one that our customers are looking for that we don't currently have, we have a very open approach to developing that.
Wonderful. Thank you. We have a question here regarding battery. So, kind of best practices for staff members to know if their battery needs replacement, battery life expectancy, and how is that reported out?
There is the badge itself has a battery check option with it. So by double pressing the two outside buttons on the badge, there are LED lights that light up on the badge indicating battery status for that badge. And in addition to that, the software tools that we have battery low battery reports. So as I mentioned when I was talking about who's going to be responsible for battery management, oftentimes those individuals are the recipients of reports that indicate staff members with low batteries. So we generally recommend that we build a process around that for, different people can be sort of involved in looking at it, but that somebody's responsible for tuning into those reports and then following up with staff.
Thank you, Mary. And we have a question in here kind of about Big Brother with the locating of the staff badge. So, Mary, I know you are passionate about that and you have some best practices and recommendations. So I will throw this one back to you.
Absolutely. Yes, it's a very common comment that we get. That's one of the reasons why I emphasize the messaging for the solution, that it be about staff safety and only about staff safety, and that's the primary use of the solution, right? So that staff feel comfortable and that wearing the badge would never result in anything punitive for them. And you really have to adhere to that in order for it to really be an effective safety solution. Otherwise, staff won't wear the badge, and then you're not gaining anything. So messaging is key, and just follow through on what you're telling them, that this badge is about staff safety.
Thanks, Mary. With all of the recent regulatory and legislative attention around workplace violence, what changes are you seeing, and how should organizations like mine be prepared and prioritize staying compliant?
Yes, definitely. Joint Commission has come out with several recommendations around creating a safe work environment for staff. And a lot of it is tied to things that we have suggested throughout this presentation. There are about 30 to 38 states that have some variation of legislation around the issue as well. Some have requirements for hospitals within that state. Some focus more on penalties for those that assault a healthcare worker, typically moving it from a misdemeanor to a felony type of a crime. And so what we are seeing is, I forgot OSHA. OSHA is also putting out new regulations around workplace violence as well. So all of these are helping to drive organizations that haven't already implemented something to look at, not only how can they meet these requirements, but also hopefully focusing on staff safety in general and how we can create a very safe experience for our staff, a safe place for them to work. So we are, the other thing I think that's changed in the landscape in the last few years is the rising incidence of violence in children's hospitals, both from the patients as well as from the parents that are with their child at the facility. And so that's actually a lot of what I've been working on the last year or so, have been working with children's hospitals. And before we hadn't seen quite as much from that group, but we are definitely seeing, and it's been driven by the incidence of violence in their facilities.
Thanks, Mary, for the insight there. And it looks like we are coming up on time here, so we want to be respectful of everybody's calendars. So we will end it there. If we didn't have an opportunity to answer your question live, we will have one of our CenTrak representatives reach out and have that conversation. But thank you so much for joining us today and for prioritizing staff and patient safety with us. And we hope you guys have a great rest of your afternoon, and we will chat with you shortly. So thanks so much and have a great one, guys. We appreciate it.
Thank you.